So here's something you probably don't hear a lot about Medicare that I think is pretty interesting, and it deals with how Medicare's fee schedule payments work. Medicare can pay drastically different prices. Oh my goodness, thought that door's gonna hit me. For the same exact medical procedure, depending on where that procedure is performed. So if you take two patients who are seeing the same doctor, one's at an ASC and the other is an outpatient hospital, they're going to pay sometimes dramatically different prices. And this service is called site of service payment, right? And I'm going to explain to you how it works because you can help your members with where they get their treatment at. So Medicare doesn't use one single payment system for everything that they do. Instead, they have different reimbursement systems depending on the setting where the value is being delivered or their care is being delivered. So physicians are typically paid through what's called the Medicare Physician Fee Schedule. In fact, you can look that up on Medicare.gov for their physician fee schedule, see what the out-of-pockets are. Now, hospitals, on the other hand, are paid through the Hospital Outpatient Prospective Payment System. Now, these systems were designed separately on purpose to cover the same service, but those services are reimbursed very differently depending on where they happen. So if you're in a physician's office, or if you're in an ASC is an ambulatory surgical center, or if you're in an outpatient hospital department, in some cases, Medicare can pay 2, 3, or even 4 times more when the exact same service is rendered, even if it's the same physician, in a hospital outpatient department instead of in that physician's office, excuse me, or in an ambulatory surgical center. That creates a really interesting incentive then inside of our healthcare system. I don't know if you've noticed, hospitals have been increasingly acquiring physician practices over the past decade, maybe decade and a half. Because when a hospital purchases a physician's practice, that clinic can sometimes then be converted into what Medicare would deem a hospital outpatient department. Now, once that happens, Medicare may reimburse services at a much higher rate or dollar amount since it's being billed for a hospital outpatient, that rate, instead of had it been billed as a physician office rate. So we're talking about two clients having the same service done, but Medicare paying more for one over the other. And from the hospital's perspective, I get it. It's an economic choice. It's an incentive financially for them, and it's part of Medicare's rules. They're not breaking any laws. But from Medicare's perspective, this is raising questions about why are you paying more for these things? You can read some of these analysts from MedPAC that are estimating that these payment differences are adding up to billions of dollars. Not like over a decade, but over a year that Medicare's spending. And you and I are feeling it too with our tax dollars. And I tell you, your patients, especially on high deductible plans, they're feeling it because Medicare beneficiaries on these plans are paying the 20% after Part B's deductible. And the total cost of that surgery or that procedure increases depending on where they're having this surgery or procedure at. So there are policymakers and healthcare economists who are proposing something called a site-neutral payment. The idea behind this site-neutral payment is easy, and in fact, it probably makes a lot of sense. If the service is the same, Medicare should pay the same amount regardless of where it's performed. So there's a lot of advocates pushing this that say this could reduce Medicare's health spend billions a year and then in turn lower the out-of-pocket cost for patients on these plans. And in fact, I'll get to that later. The other point is this. Hospitals are pushing back and they're making good points too. Hospitals maintain that, their emergency departments have very complex infrastructure and they're usually treating much sicker, more complicated patients than someone who would just go have a procedure done at a doctor's office. So in a sense, they can justify the higher reimbursement payments, but it's a debate that's costing Medicare billions. And what makes the issue so interesting is that it shows just how Medicare payment policy isn't affecting reimbursement only, but it's shaping how the Medicare infrastructure, at least on the healthcare system, is. Because these kind of payment rules, they're influencing where your care is delivered and who owns the physician's practice and how hospitals are expanding, but ultimately how much Medicare costs the consumer and the taxpayer. Because Medicare's not like some insurance program that it's for profit and they turn a buck every year. No, it's a good form of government socialism that helps seniors that number one can't afford or could afford. It doesn't matter. It's on the back of the federal government, and yet we're propping it up with their tax dollars. So conversations like the site neutral payment really matter, because this isn't like a reimbursement formula. This is how our healthcare sphere with Medicare is evolving over time. So the next time you sit down with a member who chooses a high deductible, or maybe you know someone stuck with traditional Medicare, it would behoove them then that if they're having a procedure or a surgery or some type of outpatient something done, you can do it at an ASC, you can do it in the physician's office, you should expect, not always, but you should expect a significantly lower dollar amount out of their pocket than had they done in an outpatient hospital setting.